everyone, welcome to the Spoony Life and Beyond. I'm Sarah. So today we're going to be doing a deep dive on Dercum's disease as requested by one of our followers. If you can't hear me, please let me know because I'm using a new setup. So I am vision impaired, so the chances are is I won't be looking at the camera. I do apologize. Also today, just letting you know that I'm not a medical practitioner, so this is not for medical advice, it's for awareness purposes only. So, in the meantime, how about we dive on in? So, Dercum's disease is a rare disorder that is characterized by multiple painful growths of fatty tissue, also known as lipomas. Fat tissue is known as loose connective tissue. Uh, Hence, Dercum's disease is a loose connective tissue disease. The lipomas mainly occur on the on the trunk, the upper arms and upper legs, and are found just below the skin or subcutaneously. But also can be found deeper in the body, coupled to muscle, tendons, ligaments, or bone by connective tissue. So, pain associated with Dercum's disease can often be severe. Pain may be caused by lipomas pressing on nearby nerves or inflamed connective tissue, also known as fascia, which is commonly associated with the lipomas. So, Dercum's disease mainly occurs in adults, and more women are affected than men. Some affected individuals may also experience weight gain, depression, lethargy, and or confusion, and the exact disease of Dercum's disease is unknown. So the signs and symptoms of Dercum's disease is finding is the characteristics finding of Dercum's disease is the formation of multiple painful growths consisting of fatty tissues, which are the lipomas, that are found just below the surface of the skin, but also deep. So the lipomas in people with Dercum's disease may be found in any part of the body, although they are rare in the head, neck, hands, and feet. So the trunk, upper arms, and upper legs are most often affected. The lipomas can be the size of a pea or as large as a grape, plum, or fist. Dercum's disease may occur in one or more people in a family with familial multiple lipomatosis, which is the FML type. I do apologize because I'm blind. I do the text to speech and sometimes I can't keep up. So it may occur due to angiolipomas, which are known to be painful. So and that's the angiolipoma type. Or it may occur over the ribs and including or around joints due to the presence of inflammation in the body from any cause. So that's the healing disorder type. Pain may vary from mild discomfort when the growth is pressed or touched to severe pain that is disproportionate to the physical findings. So pain must be present for at least 3 months. Some affected individuals feel that all fat hurts. So pain can last for hours and may come and go, uh, or last continuously. In severe cases, pain may worsen with movement. So many people with Dercum's disease describe exacerbations or flares or flare-ups of pain that may be accompanied by worsening of symptoms such as fatigue and brain fog. The exact reason for pain associated with Dercum's disease is unknown, but may occur because of the lipomas pressing on nearby nerves, as previously mentioned, or because the fascia is inflamed. The lipomas associated with Dercum's disease have more connective tissue than non-Dercum's disease fat. So connective tissue fascia in fat has more pain sensors than muscle. For example, when tight or inflamed, it can cause pain, as in fibromyalgia. So, fibromyalgia is not uncommon with people who have Dercum's disease. So, some individuals with Dercum's disease may experience swelling of various areas of the body, especially the hands, but often one arm or leg may be swollen and therefore more painful. So, swelling can occur for no apparent reason. Uh, though on imaging, the lymphatic system can be slow to pump in the painful limb compared to the less painful limb, or frank lymphedema may be present. So the pain may disappear without treatment, but any manual therapy, such as massage or manual lymphatic drainage, can help. Significant weight gain is a common occurrence for most individuals affected by Dercum's disease and needs to be treated to avoid progression to prediabetes or diabetes. Additional symptoms may occur in individuals with Dercum's disease, including fatigue, generalized weakness, a tendency to bruise easily, headaches, irritability, and stiffness around resting, especially in the morning, gastrointestinal symptoms, palpitations, and shortness of breath. An association with bouts of depression, memory or concentration problems, anxiety, and a susceptibility to infection, which has been noted in some cases. Additional reports in the medical literature have linked Dercum's disease to a variety of conditions, including arthritis, high blood pressure, also known as hypertension, uh, congestive heart failure, sleep disorders, dry eyes, and myxedemia, a condition due to an underactive thyroid that is characterized by dry skin, swelling around the lips and nose, mental deterioration, and infection. So, as mentioned before, the exact cause of Dercum's disease is unknown. In most cases, Dercum's disease appears to occur spontaneously for no apparent reason, so it's sporadic, though causes of inflammation should be sought. So, one case reported of development of Dercum's disease in a man after trauma, so motor vehicle accident. Some reports in the medical literature have suggested that Dercum's disease may also be an autoimmune disorder. So, a disorder in which the body's immune system mistakenly attacks healthy tissue. So, disturbances in the endocrine function and improper breakdown metabolism of fat have also been proposed as potentially playing a role the development of the disorder. So, one case reported in the medical literature was linked to the use of high doses of corticosteroids, and some cases have been linked to infection, including Lyme disease or valley fever. Some cases of Dercum's disease have run in families, and several reports in the medical literature cite the possibilities of the disease. The altered gene can be inherited from either parent or can be the result of a new mutation, so a gene change. In the affected individual, the risk of passing the altered gene from affected parent to offspring is 50% for each pregnancy. So the risk is the same for females and males. So Dercum's disease affects females more often than males, with medical publications citing the disease is 5 to 30 times more common in women. Dercum's disease can affect individuals of any age, with an average of 34 years in one medical publication. although an extremely rare occurrence has been reported in children. The prevalence of Dercum's disease is unknown, so the disorder is underdiagnosed, making it difficult to determine its true frequency in the general population. So Dercum's disease was first described in the medical literature in 1882 and by an American neurologist named Francis Xavier Dercum. So that's how the name came around as Dercum's disease. I do apologize for anyone who has recently joined. I am vision impaired, so I have to try to keep up sometimes, and I do stumble because I can hear the dinging that there are people joining. Okay, so um, symptoms of the following disorders can be similar to those of Dercum's disease. Comparisons can be useful for a differential diagnosis, sorry. So, Madelung's disease, also known as multiple symmetrical lipomatosis, is a rare disorder affecting uncoupling protein 1 and possibly brown fat tissue. So, Madelung's disease results in the abnormal accumulation of fat deposits or lipomas around the neck, shoulders, upper arms, and upper back. Adult male alcoholics are most often affected, although women and people who do not drink can also develop Madelung's disease. So, for more information on this disorder, you can choose Madelung's disease as your search term in the rare disease databases or even Google. So, fibromyalgia is a chronic disorder characterized by pain throughout the muscles of the body and abnormally persistent episodes of fatigue. The pain may begin gradually or have a sudden onset. So, additionally, symptoms may include muscle spasms and stiffness. The parts of the body most frequently affected are the back and the neck, shoulders, lower back, elbows, hips, and or knees. In addition, small specific areas known as tender points are typically painful when pressure is applied to them. So, some people with fibromyalgia may also experience chest pain, difficulty concentrating, headaches, painful and or frequent urination, diarrhea, constipation, numbness of the mouth, and or unrefreshing or non-restorative sleep. So, familial multiple lipomatosis is a rare genetic disorder characterized by the formation of multiple growths of fatty tissue, so lipomas, that most often affect the trunk, arms, and upper leg. The size and number of lipomas varies from person to person. So, some individuals may develop hundreds of small lipomas that do not cause symptoms, so they're asymptomatic and are often found in similar locations on one side of the body compared to the other side of the body. So, unlike Dercum's disease, the lipomas do not cause pain. The neck and shoulders are usually not affected. The onset of this disorder is usually during adolescence. So, familial multiple lipomatosis is inherited in an autosomal dominant pattern. I do apologize. One or more members of a family with familial multiple lipomatosis may go on to develop pain in the lipomas, along with additional signs and symptoms consistent with Dercum's disease. So, angiolipomatosis is a rare disorder characterized by multiple lipomas with increased numbers of blood vessels that contain fibrin clots and large numbers of mast cells. So, angiolipomas are known to be painful, and hence people with angiolipomas are said to have Dercum's disease angiolipomatosis type. So, angiolipomas may be inherited in an autosomal dominant manner. Several disorders are characterized by the development of benign or non cancerous growths consisting of fatty tissues, lipomas, including Proteus syndrome, uh, so P10 hematoma syndrome, and Gardner syndrome. These disorders often have additional symptoms that can distinguish them from Dercum's disease. For more information on this disorder, you can choose exact disorder name as your search term in the rare disease database or Google. So lipedema is a common fat disorder in women where increased subcutaneous fat grows to excess on the limbs. So lipedema fat can also be painful, especially when touched. So a woman with lipedema may also have Dercum's disease and obesity. The disproportion of a larger lower body compared to the trunk is uniquely classic for lipedema. The pain experience is very individual, therefore, pain cannot be used as a decisive criterion for a diagnosis of Dercum's disease. So, when it comes to diagnosis, a diagnosis of Dercum's disease is suspected based on a detailed patient history, a thorough clinical evaluation, and identification of characteristics multiple lipomas. The distribution of the lipomas is important in distinguishing Dercum's disease from the other disorders involving lipomas. So, surgical removal and microscopic studies, known as biopsies of affected tissues, confirms that these growths are lipomas. So, treatment. So, there's no specific treatment for Dercum's disease. Treatment is directed towards the specific symptoms that are apparent in each individual and is primarily focus on easing the characteristics painful episodes. Various painkillers, analgesics, have been tried with limited effectiveness. Injections of corticosteroids have also been used to treat individuals with Dercum's disease. However, in one reported case in the medical literature, the use of high dose of corticosteroids was linked as a possible cause of the disease. So, intravenous administration of pain reliever lidocaine or ketamine may provide temporary relief from pain in some people. So, surgical excision of lipomas may temporarily relieve symptoms, although the generation of inflammation or part of the healing process during and after the surgery may actually induce more lipomas to develop in that area. So, liposuction has been used as a supportive treatment for some individuals with Dercum's disease and may provide an initial reduction in pain and improvement in quality of life. These effects may lessen over time. So, there's psychotherapy and consultation with pain management specialists, which may be helpful for enabling affected individuals to cope with long-term intense pain. Other treatment is symptomatic and supportive. So there are currently clinical trials and studies. So 2 individuals with Dercum's disease who received interferon alpha 2b for hepatitis C virus infection saw improved symptoms associated with the Dercum disease. Reduction of the inflammation associated with infection with the hepatitis C virus may also have provided benefit. So, more research is necessary to determine the long-term safety and effectiveness of interferon alpha 2b as a potential therapy for Dercum's disease. So, the alternative approach, including acupuncture, hypnosis, biofeedback, and cognitive behavioral therapy, have also been tried in individuals with Dercum's disease. One patient had a reduction in pain and weight from the use of manual therapy for the lymphatic system. And so that's the manual lymphatic drainage therapy, combined with the use of pain medication called pregabalin. So that was a very long one, and I do apologize about but butchering some of those words that came through, and I do apologize for stumbling quite a bit. Um, I'm also trying to use new programs and new technology for my lack of eyesight. So I really appreciate your support. There will be another deep dive coming up shortly on Hashimoto's. I believe it's called. I'll just quickly have a look. Sorry, I should have been more prepared for this. In the meantime, we are also on Monday doing our new series, uh, the Spoony's Authentic Take, where Taryn and I will be having a chat about some journeys and stories that have been sent out and questions, so we can assist in trying to give a take on it. And people can also join in the chat, and Taryn will actually be reading out some of the questions so we can then answer them. We can have a bit of chat like we did last time. So, yeah, so the next deep dive is going to be on Hashimoto's hyperthyroidism. So that's going to be the next one. If you would like a deep dive done for you to raise awareness, just send me a private message and I will add it to the list as I do them quite regularly. That is the aim of this channel for the chronic illness, disability, invisible disabilities, and supporting the supporters. So I would definitely, if you're wanting to send something through, that would be absolutely amazing, and I'll add it to the list. And I would really like to say thank you very much for listening today. And please don't forget to like, share, and follow/subscribe. And I shall see you in the next video. Bye. Mwah.